Welcome back, everyone. So, since this morning, we've taken a cognition break, reset our brains. We framed and learned that brain economy is huge and is central to the next chapter in human capital, but none of it reaches single patient unless the systems that deliver it can absorb it. So that's next. Systems transformation for the brain economy. It's going to be moderated by Katie Evans and Dr. Reiser from UTMB and Zia Aga from West Health are participating. Please welcome all three of them. Katie, Dr. Reiser, Zia.
All right. Hi, everybody. Excited to be here today. I am Katie Evans, let's sit over here. Yeah, that'll be good. I'm Chief Program and Mission Engagement Officer for the Alzheimer's Association. And just a little bit about the Alzheimer's Association. For 45 years, we have been pursuing our vision of a world without Alzheimer's and all other dementia. We are the largest nonprofit funder of Alzheimer's and dementia research, investing $490 million. We have 1,200 active research projects right now in 59 countries. We also have been leading on the advocacy front to expand federal funding, to remove barriers for those who are looking for access to diagnostics and treatment and care. And we've also helped to advance the national plan to address Alzheimer's disease. And these investments are really important because it helped to get us to this transformational moment. Now, I wanted to start with a little story before we turn it over to our incredible panel. And I want you all to think of a patient or a family member and know that they've known something has been wrong for years. They might have missed an appointment, they're repeating questions, they are confused on how to manage their medications, maybe they're driving somewhere and it's somewhere familiar, but they get lost. Well, they eventually seek care. And when they seek care, that's where things got crazy. That is where they turned into a maze, they're down the rabbit hole, and that's where the uncertainty happens. But today, that has changed. There is so much excitement around brain health. There are new diagnostics. There are new emerging disease-modifying therapies. So we can detect people sooner, we can intervene earlier, but to me, the question that is going to define the next moment is what happens next. Because a diagnosis is not a care plan, a test result is not a treatment pathway, and a scientific breakthrough is not the same thing as a health system who can deliver it against it. And the next question for us is not necessarily a discovery challenge, it's a delivery challenge. And the Alzheimer's Association, we are launching a national initiative to transform brain health in primary care so we can identify risk earlier, we can detect cognitive impairment, diagnose Alzheimer's and dementia, support caregivers, connect patients to navigation, and help health systems deliver the next in brain health care. And let's be honest, most people are never going to walk into a memory clinic, but they are going to walk into primary care. And as we say that, if we want to deliver, all of us deliver on the promise of bringing brain health and making that a reality, the transformation has to start there. So with that, I want to introduce you to our incredible panel. We have world-class experts who are really helping build the future of brain health. And so today we're going to talk a little bit about how to take those scientific advancements and turn them into care. We're going to talk about what needs to change within health systems. And then we're going to talk a little bit about how Texas can play a role in showing the rest of the world what's possible. So with that, I am going to start with my friend, Zia. Can you explain a little bit about who you are and what brought you into this work?
Yeah, Katie, thank you so much for the introduction and for your opening remarks. And I'm going to pull on a few threads that you already mentioned. But before I do that, thank you to Project Metis and to the Houston community for welcoming us. We're from California. I represent West Health. We're so excited to be here, not just because of the focus and the center of gravity that you're creating in Houston and in Texas around brain health, the brain economy, but also, as a physician who's now not actively engaged in healthcare in terms of practicing medicine, I recognize I'm sitting in the house of medicine. Just look around you. You have some of the most prestigious healthcare systems right here on campus and in Texas. We've got UTMB here, we've got UT Texas. And so I can feel the energy and the excitement around that. The conversation we're going to have today is very near and dear to West Health and to us. And we think a lot about operational science, implementation science, innovation at the bedside. How do we take these discoveries and how do we implement them and get it to every patient who deserves the right level of care? And it's about closing that gap. And I think that work can start in Texas and spread to the rest of the nation. So I'm truly honored and skilled to have this conversation.
Thank you so much. Dr. Reiser, who my friend, Jochen, please.
Thank you. Well, a warm welcome from me again, day 2. You mentioned Project Metis, UTMB, today is the UTMB day. It's one team, and that's already a lot of the excitement. And if I look around the room and our next guests who are coming, this is more than a movement. This is really already a big wave where really the whole world is being committed to make a change. And so at UTMB, which I represent today, of course, we look at us a little bit more than just a healthcare university and a delivery system. We want to also affect the community. We want to also affect the entire state, really. UTMB was founded as the state's first medical institution and really serves as that west of the Mississippi River. So we were looking for that big moment. And brain health, mental health, the brain economy, and the fight against Alzheimer is sort of like the face of dementia diseases to some degree, became something very personal to us as an institution. And we really are all in as an institution and are willing and I think able to transform how we educate, how we treat our faculty, how we see patients on the primary care side. We want to flip a lot from treating disease to a preventative approach, which is difficult to do, obviously, and we all struggle. I said yesterday, I say it again, healthcare is broken and science is thriving. So how do we bring all of these new concepts to patient early and safe? Something we have to really think. But think about Uber. Who would have thought that we call on our phone a car and we get in a car with somebody that we don't know and feel safer than perhaps in a cab? So it is possible, but it's that level of a challenge. And then finally, as my introductory remarks, we also embarked in Blue Zones, which is a huge community project, making Galveston as a community healthier. And that means better food. It means more sidewalks. It means more focus on community and spirit. And we built a research institute, the UTMB Farms, powered by Blue Zones, alongside with it to understand the principles, the scientific premise of Blue Zone with it. So when you then look at it all together, it is clear why this is more than just a project. It's a fundamental transformation. And Project Metis and the international collaboration with Davos and the Alzheimer Association is the bigger picture in which we fit our own transformation. And that's really exciting to us. And having people like West Health here who have been committed to this change for so long, and also seeing that opportunity in the Alzheimer Foundation this just gives me a lot of energy and promise that we can do it.
So you have really made brain health an institutional priority.
Yes. And I'm a nephrologist. Okay? But luckily, the kidney, for the experts in the room, like Dr. Bardinger, is also a nephrologist. He just doesn't say it often. Kidneys have a cortex, just like the brain. Okay? But that's the only similarity. No, we made the brain central, and I said it yesterday. To me, understanding the brain, understanding mental health and brain health together as one is the fundamental component of what defines us being human. And if we don't make that the first overarching principle, I think we start out from the get-go in the wrong way.
Right. So what made you believe that a health system should lead this work versus a research institution?
So I think you need both. And luckily we have all of it. I do think that deriving new policies, understanding how Alzheimer on a molecular level, dementia, how it really works, absolutely critical. But unless you apply it and you deliver the care and you get the feedback from it, is it going well or not? You're not having the full circle. So I'm very grateful that we are having a big health system. And to me, it's very important what of the great science, what of the great policy that we are discovering or putting into action is really arriving at the health of everybody. And my hope is that with new technology, with a new movement in the state, but also in the world, we can actually do it and begin to transform care in a way that perhaps other conditions, that are also important, of course, can follow. So I think that Alzheimer research and care change and the delivery of anti-dementia strategy on the preventative side could be the broad tip that's leading the arrow also for other conditions. That's my hope.
So what do you think health system leaders, what do you think they think about, and what do they get wrong when they think about brain health?
I think I don't see it universally at the same level. So there are still a lot of healthcare CEOs who are thinking about AI as a technology that's here to maybe help securing a little bit more revenue that then can be reinvested. But to dare for an entire change are not so many. But that's why I think here in Texas, with this team, collectively, we can do it. And the responsibility of the change does not last on my shoulders. It lasts to some degree on my shoulders, but I feel the weight is carried by all of us, and we all want to carry it. So this is where the ecosystem really matters, and I think we have it here in this state. And don't get me wrong, I would love to see it in other states as well. And I do see people and leaders catch on, but there are not that many yet who are fully in, and we need to do a better job in continuing to talk about it and educate about it to make it even wider.
That's great, thank you. Now, Zia, West Health, incredible organization, it's no surprise. You guys have been in brain health for years. You also are working through some accelerators in health systems.
Yep.
So can you talk a little bit about what you've learned?
Yeah, and so I'm going to try to, again, connect the conversations today. If you think about investment and the focus of investment in healthcare, obviously the largest segment of that investment, we heard from colleagues from McKinsey this morning, is going to go towards discovery. But what helps us get those discoveries to the patients is really operational innovation. And we don't invest in that space. If you look at other sectors of the economy, like let's look at manufacturing, 25% of their investments on innovation go towards understanding workflows, improving throughput, improving efficiency, because that affects their bottom line. In healthcare, at a larger scale, we invest less than 1% in those areas. West is very committed about getting those discoveries to the bedside and to the patients, and we do that through our accelerators that we launched. And we have 5 of these today, and I'm going to give examples from these in terms of like, how is it really? When we think about operational innovation and getting the best practices and the care delivery to every patient, there are many, many, many bottlenecks. If you talk to the clinicians that are working in these healthcare systems, there's burnout, they're overworked, they have too many conflicting roles. The teams are developed, even if they are performing something new, it often stays in one floor or one part of the hospital. There aren't mechanisms to take those best practices and scale them across the whole enterprise. And then there's no sense of how do you capture the return on investment and the value proposition. And so when West thinks about the accelerator, we really focus on dedicated teams that wake up every day to talk about the innovation and operationalizing that innovation. We have dedicated sort of teams of IT and support, so you can get the tools, because we have the tools. We don't have to invent new tools often, but the tools are not being deployed in an organized fashion. We have a lack of data, so we work really hard to get the data in somewhat real time, because if you find out 6 months later what you did wrong, it doesn't really help you from a clinical or operational perspective. And we bring in implementation science and change management and ethnographers to really study how workflows are being developed. If you go to any hospital and ask them how they do things, they'll tell you a story. And then if you go and observe how things are actually happening, it's completely different. Yeah, so you have to be able to study those things. And I think that's the partnership that we do with healthcare systems. And I think it's really helped us compress the timelines on getting the desired outcomes, and it's helped us shorten the gaps between the best in class floor or staff or nurse to everybody else. And I think that's the opportunity with Texas around brain health, to pull that thread through, to compress the timelines, to support these fantastic healthcare systems and achieve those outcomes that we all care about.
No, it's so great. So let's talk about primary care a little bit. Yeah. You've often said that this is the highest leverage point and entry point for brain health. Can you talk a little bit about that?
Yeah, and look, I think we're sort of very focused up on what we call our sort of place-based strategy. So place can be geographical, so Texas and Houston is a place, and you've got a center of gravity here. I think when you think about healthcare systems, it involves many settings. Each of those is a place, if you would say. It says long-term care, nursing home memory units, specialty care, inpatient, and primary and ambulatory care. I think if you think about where the largest opportunity for impact is to close the gap in brain health, it is in primary care, we believe. 20% of our primary care patients are going to have either a primary or comorbid diagnosis within brain health, so things like dementia, depression, anxiety, substance use. You also have the opportunity, like Jochen was saying, to intervene early in primary care. Why should we wait till somebody is late stage and then intervene when we can get upstream and be more proactive? But at the same time, primary care itself is being stretched thin. So to me, the analogy here is not about building, just more capacity, and we've done some of that modeling work with our colleagues from McKinsey Health Institute to look at what would need to happen to primary care, the delivery system, in 2030, 2050, for us to be able to deliver, not just to what we think the population's growth is going to be, but also the change in case mix. Tim talked about this yesterday. Our population is not just growing older, but growing sicker. And how do we take care of that? At the same time, we have more technological advances, more sophisticated treatments coming up, and those need to be coordinated and delivered through primary care. So I think it's a fascinating and important time to engage with primary care as a whole. to support that system, to reimagine it. And some of that work is already happening with integrated care models, team-based approach to care, where it's not about one provider and one patient, but you're managing panels, and those panels are managed by different staff working up to the top of their level. And of course, the latest addition to that staff is now AI. We heard yesterday from Jamie McCarthy that his doctors love ambient listening, and if he took it away, they would kill him. And I believe him, because I think that has reduced their workload in terms of documentation burden, which is a small but important part of supporting these teams. But there's a lot more that we can do to restructure, reorganize, and help them deliver to the top of the license.
Great, thank you. All right, we know that health systems have historically treated behavioral health. They know it's a financial loss, and they've also treated dementia more on the social services side. So what has to change for health systems leaders to really think about the financial case?
Right. So, first of all, I want to echo everything that Sia said. I think you have the principles really right, but you're asking the critical question. So, many places have attempted to improve access for mental health, behavioral health, even brain health from a more structural perspective, and it opened the floodgates. It became very quickly financially not sustainable. But this was essentially more a broad focus where systems said, let's open the doors, and then we see how to deal with it. It won't work. We need to flip primary care. We need to really employ primary care. And that means we need to offload primary care providers, let's say by 20, 30% of their work. Non-essential tasks need to go to AI and some physician extenders, create capacity, change the compensation. And I'm not saying we're doing it, okay? I want to be very clear. We are talking about this. We don't know yet how we do this, but that's how I think about it. Change the compensation to more of a value-based component, and then let the primary care physician really be the quarterback of the care, where the results come back, discussed with primary care, reapproached with another provider, and also with a big focus on prevention. I think if we attempt it this way, we can do it. And the fuel we have is really AI, because AI is going to gain us not so much money, I'm not thinking about that, more time. It's going to bring time back to the provider, and we're going to say, we're going to value that time that you now have with a different component, and for that, we're going to compensate you, and that will allow more capacity and really employ primary care the way we all envision it, and we really haven't done it in this country. There's a lot of referrals that come in through specialty care. Remember yourself cases. When you have a GI problem or a shoulder problem, how often did you really go through primary care versus trying to get to your orthopedist right away? So this needs to be redirected if we really want to try and make this new approach available to everybody, which it should be. So I think that AI gives us the opportunity to do it, and the flip will be complicated and has to really be redesigned from scratch. And let me also tell you, it's not escaped my attention that conceptually we are there, but practically, how do you reach an organization with 16,000 employees so that really people at the end or at the front line, depending how you look at it, really understand what it is that you want to do? And that's why the principle of Blue Zone, mental health focus, brain economy, the change in education around it, AI literacy, all of that helps people to understand why it is that we're doing it. So the mission-driven part of an organization, in my mind, is essential to really doing this transformation. You can't just focus on the part of the transformation itself. You really need to create the larger mission-driven component with it.
Thank you. I'm going to take something you said about AI Now, West Health has done some cool modeling with McKinsey Health on primary care capacity and AI. Can you share a little bit about that?
Yeah, so I referred to that. And, if you think about, like you're saying, how do we offload some of the, what I would really call administrative and back office type activities from some of our primary care teams, one can model how tools like AI today, or there are other ways to do it also, would have an impact. And because if you think about the number of primary care providers that this country has, it's not a huge shift that is needed. In fact, I was surprised. Some of the analysis showed us that if we could, add one more patient to a daily workflow, you could catch up to 80% of your capacity gap without creating any sort of, a huge new up-ramp of new doctors, nurse practitioners, and whatnot. So, the efficiency gap is not that big. It's like maybe 10 or 15%. Of course, the goal here is not to add one more patient to a doctor's day. That's metaphorical. Yeah. I think the goal really is to reduce the burden of some of the routine stuff that can be offloaded to other team members, including AI, to streamline, how we practice, and really make it a team-based approach. I think one thing that's really important to understand here is that our current healthcare financing system is set up such that it's the doctor-patient interaction that gets reimbursed. All the teamwork we do around that in a fee-for-service system does not get paid for. So when you talked about value-based care, once you start to embrace a value-based care system, then suddenly everybody on your team is part of the RVU or revenue-generating person on the team. They're not a cost center. In most healthcare systems, we look at nurses, who are the lifeblood of healthcare, as a cost because they don't generate revenue. I think that has to change because the financial incentives have to change. Yeah, and if that happens in primary care, and there are innovations happening. There are examples like Oak Street and ChenMed that are reimagining how primary care teams can function, deliver better care, yep, and manage healthcare costs. We at West Health, we care a lot about both of those things. How do we close the gap, but also don't add in an exorbitant number of dollars to an already really expensive healthcare system?
Well, is there anything in the accelerators that you all did when you knew the infrastructure existed? How did that impact clinician engagement?
Yes, I'll give you some examples of how some of and these are really, specific examples. At Mass General Brigham, where we are working on the inpatient side, one of the work streams is focused on inappropriate medication prescribing. Especially for older adults, there are certain medications, they're called the PIMS medications, that if they are prescribed will give a much higher risk of having a side effect. If you open a modern electronic health record and you want to order a medication, it literally provides you every medication alphabetically, A through Z. It's not filtered based on your age. It's not filtered based on your allergies. It doesn't prompt you and make it intelligent. And so we work with the team at MGP and Epic to take that cognitive load and that opportunity to make a mistake away from them. So now at MGP, if you go in and you're a 70-year-old patient and we know your allergies, the software automatically removes those medications that are bad for you, changes the dosing algorithms to your age and your comorbidities. And so it's one click less for the doctor, one thing less to worry about. And not only are you reducing bad side effects and complications, you're enhancing workflows. And really, in my mind, that's the future of personalized medicine. Personalized medicine is not the fancy $1 million a year visit you can get in Florida and get your genome tested. It's about getting the right care at the right time at the right place. And I think that's the future.
I love that. Well, Jochen,
I can add directly to that.
do you want to add? Go ahead.
Yeah. No, I agree. However, I want to just point out something for the audience, and maybe this is all clear to you, but how do health systems today financially grow? Increase the number of patients they see, add on another service line, more throughput, less hospital stay. But typically, the expense grows with the revenue gain. And the delta, the margin, remains the same. So UTMB since 3 years is about $1 billion stronger. Sounds great. But the margin is really the same. Now we invested more back in the organization to get us ready for this transformation. And here's the difference in time. AI. AI can bend this curve. The costs will come down and the gap will get wider. And that more margin we can reinvest in the transformation. And it brings us time back to the frontline providers. So this is why this is for the first time a tool that really can achieve that. But it can only achieve it if you use AI pretty much enterprise-wide. Right now, AI is being deployed more in a pilot-type fashion. Let's see how it goes. Let's begin to understand it. And it's not, think of it, if you construct a car and you would have AI just for the process around dropping the engine into the chassis. It's not enough. You need the entire workflow being automated to some degree. And then you get the full benefit of it. So I think we can do this because we have this tool now available. It's going to be really important to do it this way. But the other part that I'm seeing, which is exciting for brain health, I want to come back to, is we see other industries also trying to make the shift. And that's why yesterday was an important day. I had colleagues in here talking about the health of the soil, trying to understand to grow healthier crops. And with that, we go into the nutrition industry. We have the oil and gas industry being interested in it. So there is going to be a more uniform approach toward health. And this will allow our patients to be more educated because they will hear it, not just from the healthcare industry, but also from other industries. I think that's going to be really important. And then finally, I want to say, we will have to get comfortable with the fact that some of our healthcare is going to be really managed by AI. 10 years ago, it was all about the digital front door. Apps, making sure that you can schedule online your appointment, all of this. Guess what? The digital front door today, 10 years later, is broken. The digital front door is being replaced by OpenAI, Claude, Anthropic, all of it. Because patients now punch in their problem and they get a very good analysis, potentially even a diagnosis. And I personally don't see a problem why we couldn't take an antibiotic prescribed by AI for an infected finger. And if you do that and combine that with the primary care provider's work, we offload even more. And we create more capacity for more complex situations where we truly need the physician. So we are living through these very interesting times, and I think we have tools available in situations and knowledge that we never had, and we have the society ready, and we'll see how this plays out. But for the first time, I'm really optimistic that a very meaningful shift can actually be done.
Can I add to that?
Yeah, of course.
So we do some
Just
don't
say anything against what I said.
Well, I'll
course
agree
you
and
can.
disagree. We do some really fascinating polling and survey work with Gallup. We have a long partnership with them and launched the Center for Healthcare in America with Gallup. And in one of our recent surveys, we touched on the topic of AI from a consumer perspective. And we found that almost 75 to 80% of patients are using AI in the context of their office visit with their doctor, either before the visit to sort of get prepared and do some research on their conditions, but also after the visit. People are uploading their lab results, symptoms, and using that to support their understanding of their illness and their condition. So that's one data point, and that's happened very rapidly. If you did that survey a year ago, that number would be in like 10%.
Agreed.
The second fascinating question we asked them was do you always trust what your AI agent, whatever the favorite agent is, Chat or Anthropic or whatever? Only 20% said they trust it. 80% said, well, we look at, we research it, but we do not trust it yet. So I think there's work to be done to sort of integrate some of these tools, and we're seeing that where the health systems are going to develop their own agents. And now, if the AI agent who's giving you advice is a UTMB white-labeled agent that has access to your full medical record and understands your clinical situation and has been trained by some of the leading physicians at UTMB, I can tell you that trust from 20 will go far up to 70, 80%. So I think there's work to be done there. Using these general tools, I think, are really replacing what we used to use Google for. Like, we used to Google our symptoms and do the research. But, and this is happening really fast. So I think next year when we'll be sitting here, you probably will have more data, and we'll have more surveys that will show how rapidly this gap is closing.
Yeah, I was going to ask you guys, what does success look like? But here's what I would say. History is not going to remember the tests we develop. They're going to remember the lives we've changed. And the future of brain health is not necessarily going to be just determined by what we discover, but by what we deliver. And that work has started today. Thank you.
Thank you so much, Katie and Priya.